Health Education England is working with Nick Perez, who's the head of technology at the Horizon Centre, on the creation of the VR Lab, which is a dedicated space for exploring the potential and the uses of virtual reality and augmented reality in healthcare and in healthcare education. This film shows learners using 360-degree virtual reality headsets to review their practice.
So the Horizon Centre is our education and research base here at Torbay Hospital, and the Horizon Centre has been set up to not just look at traditional simulation, but actually the impact that these new technologies are going to have in healthcare. One of the projects we're really excited about and working with Health Education England with is the VR Lab. And the VR Lab is to investigate further the technology affordances of virtual reality. How do we use it? How do we operate it? What are the best experiences for it? And so the VR Lab is set up to create a resource for other hospitals and other clinical-minded people and people working in healthcare to see how virtual reality can affect both their teaching and their education, as well as what it can do for patients. And so virtual reality is becoming quite a mainstay now in some of our classroom-based learning. And we use it for our Teorema-based and human factors-based training, as well as an extension to our actual simulation program. And so we're looking at how we can review or replay simulation activity through 360. So they were watching a simulation, a community-based simulation, where one of the patients that they go and visit in a community setting collapses and they have to resuscitate him. But they're also noticing in that environment all the things that might be wrong or might need correcting. So for instance, there's a gas canister which looks a bit dodgy in the kitchen environment. It's unkept, it's unclean, there's no food in the kitchen at all. And so those are sort of things that we can miss in the heat of the moment, if you like. But actually when we replay them, we can start to understand there's far more to this landscape than simply the task at hand. And 360 video opens up those kind of areas or views that we kind of forget. And so we've been using 360-degree video to film from the patient perspective in a number of these scenarios, and then allowing our clinicians to watch that film back using virtual reality headsets. This has been a really, really great interactive element to bring into the classroom, because it allows somebody to become the patient, if you like, to look around the whole environment, to notice what the patient sees. And this switch of perspective is very important when we talk about compassionate and empathy-based care, as well as sort of communication. Because until we get that moment where we can shift into someone else's shoes, we don't probably understand what it's like to be a patient, come into these environments that we work in day out, and how it looks, how it sounds, how it feels. And that's what it's all about. It's about how we can care for our patients, not just from the medical point of view, but for their mental state, for their emotional state, and we will have a part to play in that. Our traditional simulations is very expensive, as you can imagine. You have to have the equipment to set it all up. You have to have the staff to be able to man that. What virtual reality allows us to do is to start looking at a more accessible way to experience not just technical skills acquisition, but actually the non-technical skills very, very effectively. So as I said earlier, this idea of jumping different perspectives. There's a big price difference between £2,000 piece of virtual reality hardware and a £65,000 mannequin. And so therefore virtual reality as a platform offers us a new access point to some very, very important sort of teaching and conversations that need to happen, only it's not based in the simulation suite. The simulation suite, as great as it is, we need to look at how we can come out of that, how we can bring learning not just into our classrooms, but the clinical environment as well. So the VR Lab, although it's going to be a physical space as well for people to come and try and come and experiment and to come and research certain platforms and software, it's also about best practices. It's also about how do we sustain this idea of open source, for the better kind of experience to other hospitals. And virtual reality is one such technology. I think there's augmented reality, there's video technologies that we still need to tap into more, and looking at other technologies that produce a simulated effect, if you like, is a very important thing that we need to start considering. And as a case example of that is we have a patient up in our ICU who's been there for some time, and previous to being in the hospital is a kind of very active person. Despite having this medical diagnosis and condition, living with that, he would go out cycling. And so for me, it was like, how can we get our patient Nick out of this environment back to what is good for him, back to what he loves? And so we were able to create, in collaboration with Birmingham University, an experience for Nick where he could hook up his cycle machine to a visual interface, and that visual interface would have him cycle around locations around here which he knows and he's familiar with. And the reaction was so that Nick was quite emotional about it. He was seeing himself pedaling around this environment, and for a little while those walls disappeared. And to me, those are those golden moments where these new roles, this new technology has a massive influence in healthcare. It's very humbling, but also tells me the potential that we have as creatives, as software developers, as coders, have in this new healthcare setup. We are no longer a luxury bolt-on service, the technology teams. We can work with our clinicians, with our colleagues to actually improve the system as a whole.